president will declare a national emergency this afternoon, and the state just announced 6 new cases of coronavirus in Pennsylvania. Still no known cases in our area. There are now 22 presumed cases in Pennsylvania, 6 more confirmed by the CDC for a total of 28. All of them are in the eastern part of the state. The state Secretary of Health is set to give us an update today at 12:30. The U.S. House is debating a deal on a major economic relief package, and a vote is expected later today. And more breaking news, West Virginia's governor just announced he is closing all schools in that state, joining Michigan, Ohio, Maryland, and Kentucky. Governor Tom Wolf, left that decision up to districts in Pennsylvania, and several local schools have closed. As you know, we don't have any known cases around here, but the schools want to make sure they are as clean as possible. The public schools listed on your screen are closed. Many of them are returning to classes on Monday. That's the case for all the schools you see on this screen, many of them Catholic schools. Today they are closed for cleaning. SAT testing at Hampton High School that was scheduled for tomorrow has also been canceled. If you planned to go to a school event over the next few days, you should check first and make sure it hasn't been canceled. We have a section of all the closings online at WPXI.com. If you are wondering what is staying open no matter what, take a look at your screen. At this point, the governor has ordered everything you see here to keep their doors open. Governor Wolf is asking people to avoid unnecessary contact with the public and large gatherings. He says while that may seem severe, it is far less severe than what we could have to do in the future if we don't act now. Because of those recommendations by the governor, Stage AE has shut down. In a statement on Facebook, the venue says it will remain closed through May 1st. It says that date could change and hopes to reschedule as many events as possible. NBC's Tom Costello has more on the drastic changes being made across the country.
As the federal government races to respond to the coronavirus pandemic, the nation's top infectious disease expert is sounding the alarm over a lack of testing kits for Americans.
The difficulty was the connection between the people and the process, and connecting them with actually implementing the test was the reason why people, as you know, are calling in saying, I tried to get a test and I couldn't get it. Hopefully that's behind us.
With health officials urging the public to practice social distancing to slow down the outbreak, communities around the country now taking action.
We must treat this like what it is, and that is a crisis that we have not seen, most of us, in our lifetimes.
Ohio shutting down public schools for 3 weeks. Maryland schools closed for 2. Also New Mexico, Michigan, and Oregon schools. California now banning all gatherings of 250 people or more. And New York City's mayor declaring a state of emergency. Meanwhile, President Trump is defending his decision to ban most Europeans from entering the country for the next 30 days.
I just wanted that to stop as it pertains to the United States, and that's what we've done. We stopped it.
The president even acknowledging travel inside the United States could also be restricted. Also this morning, the White House is acknowledging the president attended an event at Mar-a-Lago last weekend with a Brazilian government official who's tested positive for the virus. The White House insists the president had almost no interaction with the individual and does not require a test at this time. Over on Capitol Hill, Republicans and Democrats are inching closer to an emergency aid package to help Americans impacted by the outbreak. The package would include expanding funding for paid sick days, shoring up safety net programs like food assistance, and funding for free coronavirus testing. American Airlines says one of its pilots tested positive. He was flying out of Dallas-Fort Worth. The airline believes the risk to the general public, the flying public, is minimal. I'm Tom Costello in Bethesda, Maryland. Back to you.
Catholic churches continue to make changes because of the coronavirus. All dioceses in Pennsylvania, including Pittsburgh and Greensburg, have now suspended the obligation to go to Mass. Non-essential gatherings are also canceled starting on Monday. Masses will still continue for those who want to attend, but leaders are asking parishes to change their Lenten fish fries to takeout only. More than 100,000 people use Port Authority buses and trains every day, and the Port Authority is doing everything it can to stop the spread of the virus. It has ramped up cleaning significantly. Normally, they would be disinfecting every 30 days. Now they're disinfecting surfaces on buses and light rail vehicles every 72 hours. They have also installed hand sanitizing dispensers at several stations and have plans to install more workers. The workers have also been given hand sanitizer. As for supply, when it comes to cleaning products, officials aren't worried.
We don't feel that that's going to be an issue. We have right now at least a month's worth, and we hope that, well, we know that it'll be available should we need more. We will not run out.
There are no changes to any schedules, but this is a fluid situation, as you know, and that could possibly change. There's a good chance you've seen some empty shelves at stores. Some supplies are still hard to find as people are stocking up because of coronavirus. We got to look at the conditions of this giant eagle in Peters Township. Things like toilet paper, water, and cleaning products are going fast. Stores are urging people to remain calm, and they're asking everyone to limit their purchases. An update on a passenger who flew from New York to Florida while waiting on a coronavirus test result. JetBlue Airlines has banned the passenger for life, citing the safety of the crew and other passengers. That passenger underwent a test before boarding a plane at JFK Wednesday. When they arrived in Palm Beach, the passenger learned he had tested positive for the virus. Stay with Channel 11 for more coronavirus coverage. We have all the resources you need on WPXI.com and on the WPXI News app. The rain is pushed through, but there are strong wind gusts. Meteorologist Stephanie Allison has her forecast in Severe Weather Center 11. Stephanie?
That's right. So we have this cold front that's moving through, and it's bringing in a little bit cooler air to the forecast now. As you can see, it's cooler than we were yesterday at this hour. Yesterday we hit 64. This morning was the high for the day at 57 early on as you walked out the door. Now, of lunchtime, cooler air is filtering in behind the system, and also it's bringing in drier air. So we have a brighter sky this afternoon, but as you can see on the tower cam, you can see the trees blowing there in the wind. The tower cam's been jiggling around quite a bit. We've had gusts over 30-35 miles per hour across the area today with this system. So right now 49, so cooler than it was at 5-6 a.m. this morning. But look at the sky. Beautiful conditions now as that drier air now moving on in here for a brighter afternoon. You need the sunglasses. Tonight you'll need that heavier coat because temperatures cool off in a big way back down into the lower 30s. We go for our overnight lows. So current temperatures, you can kind of see where the front is. Look at this. Cumberland 64, but back through Cleveland 44. So that cooler air filtering in now as we're going to have some cooler air into the weekend. Current wind speed 16 in Pittsburgh, 23 in Greensburg, but gusting much higher. A look at that hour-by-hour wind forecast and when those winds will die down into the weekend. That's coming up in a little bit. Peggy?
It is back to jail for an accused killer, Adam Rosenberg. He is charged in the murder of a Baldwin man. Channel 11's Liz Kilmer was in court this morning when Rosenberg faced a judge.
This morning, all charges were held for court here in the case of Adam Rosenberg, accused of killing a Baldwin man inside his home. Today, the judge said the evidence against him is circumstantial, but, quote, powerful. Loved ones, friends, and family of a man slain in his Baldwin home entered court Friday morning facing that man's accused killer. 21-year-old Adam Rosenberg is facing homicide, robbery, and other charges after police say he arranged to meet 28-year-old Jeremy Dental on the evening of February 15th. Based on surveillance video and cell phone records, investigators believe Rosenberg entered Dental's home here on Vernon Avenue, shot him in the head, and left all in under 1 minute, taking the victim's phone with him. During his preliminary hearing, a judge held all charges, calling the alleged killing shocking and sickening. The defense attorneys leaving court with the suspect's parents tried to challenge the evidence, noting the surveillance video captured doesn't identify their client.
As Judge Barton said, most of the evidence presented today was circumstantial. So right now there's not an identification of our client, but again, there's a lot left to be uncovered.
I asked the defense attorneys if they intend to take this to trial or if they may reach a plea agreement. Their answers coming up tonight at 5. From City Court, I'm Liz Kilmer, Channel 11 News.
And more details. Police continue to investigate the death of Christian Moore Rose, whose remains were found near Rosenberg's Fox Chapel home. The victim's mother told Channel 11 the two had been acquaintances, but at last checked, Rosenberg was not facing charges in that case. 2 people were taken into custody after a robbery victim was shot in the back in Westmoreland County. That shooting happened Wednesday at Wood and North First Streets in Jeanette. The victim survived the shooting and gave police a description of the suspect's truck. According to the Trib, Ronald Lee Johnson of Pittsburgh shot the victim in the back. Johnson is charged with robbery and aggravated assault. Alan Sloan of Forward Township is charged with conspiracy. There will not be a strike in the Bell Vernon Area School District. A tentative agreement was reached overnight. Teachers were ready, though, to walk off the job today if no deal was reached. Details of the agreement will not be released until both sides take a formal vote on that, and that is expected to happen within the next few weeks. Coronavirus proving to be a big stressor for a lot of people.
I try not to be stressed out, but everyone around me is making me stressed out.
We're talking to a psychiatrist about how you can reduce your anxiety. And fewer new movies at the theaters, the big budget movie that's now been moved to next year. What theaters are doing to keep people safe from the virus.
You're streaming WPXI now, your source for original local shows, Steelers, Penguins, Pirates, and more. The hottest Pittsburgh sports topics with even hotter opinions. Halftime adjustments. Wednesday nights at 7:30 on WPXI.
Near you, Channel 11 is there.
Aliquippa, Coraopolis, Moon. We cover news everywhere you live.
That's what makes Channel 11 News different.
We're in McCandless, Cranberry, Butler. For news from where you live,
watch Channel 11 News at 5.
Channel 11 News at 5, covering more news happening in Washington County. The decision to cancel so many sporting events is affecting people whose jobs depend on those events. Restaurant servers, bartenders, they're taking a big hit. This week, the NBA and the NHL both suspended their seasons. The NCAA canceled March Madness. Major League Baseball has delayed the start of its season by 2 weeks. We talked to a server at Jerome Bettis Grill 36 on the North Shore.
It's everything. Everything. And that's how we make our money. We're a sports bar.
Governor Tom Wolf is asking people to stay at least 6 feet away from other people in public. Well, we've heard it over and over again. If you feel sick, stay home. And even if you're not sick, try to avoid large crowds. But many Pittsburgh institutions are staying open despite the threat. with extra precautions, however. All 4 Carnegie museums continue to welcome visitors to the galleries and public programs. Additional hand sanitizer has been placed throughout the facilities, and staff members have increased cleanings on all touch points, including the interactive exhibits, handrails, tables, and elevator buttons. The Children's Museum says it's also stepping up cleanings. None of the exhibits are closed, and the museum says it has not noticed a drop-off in school visits or customers. The Carnegie Library is removing toys and puzzles that might get passed from child to child, and it's also put signs up warning people about the coronavirus. Also staying open, the Pittsburgh Zoo and PPG Aquarium, because it is mostly outdoors. The zoo says visitors aren't as confined, and it has not seen any decrease in visitors. Starbucks says it may take measures to protect workers and customers by keeping only its drive-thrus open. The coffee chain is also prepared to restrict ordering to the app for pickup or delivery. Some locations may limit seating inside to discourage or encourage, social distancing. And as a last resort, Starbucks says it may temporarily close stores.
I don't know why you came all the way up here. There's nothing left.
The movie release schedule got quite a shakeup. Studios envisioned theaters emptied by fears of coronavirus. Paramount postponed its release of A Quiet Place Part 2 just 8 days before its scheduled debut. Disney delayed Mulan, which had been due out March 7th. And Universal pushed back Fast and Furious 9 from May 22nd to April of next year. Cinemark Theaters says it is carefully monitoring recommendations from the CDC and health agencies, and they have elevated their cleaning and sanitation protocols, continuously disinfecting high-touch surfaces, and enhancing deep cleaning every night. We understand all this news about coronavirus can be stressful. It is for us, too. We're finding out what effect all this anxiety could have on you. Channel 11's Angie Moreski spoke to a psychiatrist about how to stay calm in such a scary time.
Pittsburghers are feeling the impact of coronavirus.
The elbow bump, that's it.
Changing our behavior driven by fear of the unknown.
Anxiety. I have a lot of anxiety over it.
It stresses you out pretty, like a lot, but hoping everything's okay.
I'm a hockey fan, and now I don't have a game to go to.
Dr. Jack Rizal with UPMC Western Psych Hospital says feeling that anxiety is perfectly normal.
I think it's very human to feel anxious in a situation like this. The information is evolving quickly. The situation is changing on a day-by-day, if not hour-by-hour basis. There's a lot of uncertainty. There's a lot of fear.
To help feel better, take control of what you can to minimize your risk. I know we've heard it before, but wash those hands and try not to touch your face. Wipe down common areas that you use regularly and try to avoid crowds.
At the same time, it's important to realize the impact of isolation.
If you're isolated, people can have problems with feeling more depressed, more anxious, more worried. We certainly worry about the impact on isolation with substance use, where people might have more problems with substance use than they might usually have.
Be sure to stay in touch with family and friends and take care of yourself.
I just try to be calm.
Angie Moreski, Channel 11 News.
And our coverage of the coronavirus continues in our next half hour. Still ahead, the technology local researchers will use to forecast the virus.
Your severe weather Team 11 forecast.
Well, what we're tracking here is those gusty winds. We had those this morning. They'll continue this afternoon. Now, what we have is brighter skies. That's good news. You know, we had the rain this morning. We also had those cloudy skies, but breaks for some sun earlier. Now we have much brighter skies, and that will continue all afternoon long. Cooler air behind this front now into the weekend. As you can see out of the tower cam, a much brighter sky out there, and the wind is blowing. We have that west wind at 16, gusting much higher at times. So here is what you can expect through the daytime. Know that you'll need the sunglasses all afternoon long. We have this bright sky out there. We will continue to see clear skies for us overnight as well. The PennDOT cam here is not loading, but I just wanted to show you how bright it is now compared to when you stepped out the door this morning. So big changes here now as we move through the second half of your day and into the weekend. We had a nice warm day yesterday in the 60s. Today we'll start to notice it's a bit cooler this afternoon, and certainly with that breeze makes it feel much colder than it actually is. That wet weather now out of here, that front bringing in that drier air and that cooler temperatures as well. So 49 now in Pittsburgh. Our high this morning was 57, but some colder air off to the north. Mercer at 46, Butler at 48 right now, Pittsburgh 49. And with the sunshine, though, this afternoon, marks will come up a few more degrees here as we move into the afternoon hours. 55 in Greensburg, 52 in Washington, but overall, where we're at right now is not far off where we're going to be here this afternoon. So lower 50s for many, some of us staying in the upper 40s, and then those marks drop off pretty quick tonight because we have the clear skies. The light winds will come into play tomorrow. But until then, we have these strong wind gusts up to 30, 35 miles per hour. So current wind gusts right now, 35 in Greensburg, 30 in Pittsburgh. This is what's happening right now. Here is what is to come as we move into the afternoon hours. So those wind speeds this afternoon, anywhere sustained at 15 to 20 miles per hour. So very breezy afternoon with wind gusts much higher. So as we move into about 3, 4 o'clock, look at these wind gusts. 22 miles per hour in Pittsburgh, 25 in Butler, 25 in Washington. This is 4 o'clock this afternoon, so gusty winds there. Into the evening, that wind will feel cold because those temperatures will start to really tumble once the sun goes down. So looking at wind gusts up to 19 miles per hour in Pittsburgh, Butler at 19, and this is the timestamp there at 7 o'clock. So maybe you want to head out this evening for a walk after dinner. It's going to be cold and it's going to be windy as those temperatures start to tumble off. So as we move through the overnight hours, those winds will die down there as you see, and tomorrow a much lighter wind in the forecast. So this evening, 44 at 9 o'clock. So maybe if you're headed out for an evening walk, 47 at 7 o'clock, but as I mentioned, still gusty winds there, so it's going to feel much colder. You might want to have that heavier coat for you this evening. Clearing conditions for you overnight with those decreasing winds. A light wind for tomorrow, so 31 overnight in Pittsburgh. Some areas will dip down into the upper 20s tonight. Clouds move back in tomorrow. We do have a chance to see a few spotty showers or a little bit of a mix south of the city tomorrow evening, mainly after 7:30, 8 o'clock. Looks right now that may stay south of 70, something we'll keep an eye on and keep tracking for you as we move into the weekend. But we will have more cloud cover tomorrow, and it's also going to be a bit cooler. Look at those wind gusts tomorrow, very light, not a concern at all in the forecast for Saturday, but we're just going to have some cloudier conditions and also some cooler air. So it was 60s yesterday, 50s this morning. Now we're talking 40s for the weekend, 46 for tomorrow, 47 on Sunday. But we do have a great weekend in store. Yes, it's going to be cooler, but we're going to stay mostly dry besides that chance of a rain or snow shower late on your Saturday afternoon. I'll tell you if we have a chance to see some drizzle and who could see that as we head into Saturday night. Plus a look at Monday. Look at that, 55 Monday. So we rebound nicely into next week with a chance of a few morning showers on Tuesday.
A new investigation into volunteer firehouses, the effort to make sure they are getting the money they need to serve our communities. Plus, a new cybersecurity threat, the social media app that some want to ban.
Hey Pittsburgh, if you haven't signed up for local steals and deals, now is the time. Just get out your phone and text the word WPXI to phone number 65,000, and I'll send you everything you need to get the most exclusive deals in town. That's WPXI to phone number 65,000, and you'll be the first to know.
A special song and a meal to honor police. The local elementary school hosted nearly 20 officers to teach students kindness and an appreciation for law enforcement.
We really appreciate when we are invited to take part in things like this.
Giving back to those who protect and serve makes us proud to be from Pittsburgh.
Proud to be from Pittsburgh. Brought to you by your local Honda dealers. Great cars, great people. For a great deal on a Honda, visit shop. forecast, now on your screen all the time on Channel 11 News.
They train hard, they work even harder. But are volunteer firefighters getting enough resources to keep the community safe? This week, the state's Auditor General launched a review of firefighter funding. He wants to make sure that they are getting the maximum amount needed for training, equipment, and general operations. The review will also look into expanding how the money can be used. There are more than 2,500 volunteer fire departments in the state. Last year, funding was just shy of $60 million. A local township is looking to attract more businesses by changing the rules on signage. The new ordinance in South Fayette would allow rooftop signs in its business districts. Our Trib partners are reporting the proposal has a long way to go, though. A public hearing will be scheduled next month. New cybersecurity concerns about a popular social media app lawmakers say may have ties to China. 2 senators introduced a bill to prohibit federal workers from using TikTok on their government-owned devices. These senators say there's national security risks, even though TikTok denies any ties to the Chinese government.
It doesn't cost anything, and it could save billions of dollars and really stop the identity theft of hundreds of Hill staffers.
A TikTok spokesman calls the concern unfounded. He says TikTok this week opened a so-called transparency center in California to give insight into how the company approaches data privacy and content moderation. Well, despite the coronavirus, people are still heading out to places like the Rivers Casino.
Did you play it all today?
Oh, yes.
Oh, yeah.
Yeah, we had lunch in there.
We asked what's being done to protect people hitting the slots, even as coronavirus concerns increase.
Weeknights on MeTV. Watch The Flintstones at 6, MASH at 7, and Andy at 8. You can find MeTV on Comcast 190, 207, or 1169, and on these and other providers.
WPXI Now, your source for original local shows. Get the inside scoop on all the hot events, entertainment, and celebrities in and around Pittsburgh every week. Stream Access Pittsburgh on demand anytime on WPXI Now. Make sure you know everything happening in the morning. Watch Channel 11 Morning News.
Duquesne Light is removing its employees from the Home and Garden Show. According to our partners at the Trib, the show sponsor is doing this to limit exposure to coronavirus. If you go to the show at the David L. Lawrence Convention Center, you will now be greeted by a sign explaining that decision. None of the other exhibitors have pulled out of the show yet, and it is expected to continue through Sunday. Places like the Rivers Casino remain a hot spot despite coronavirus and the governor's request to stay away from other people. Right now, the Rivers Casino only told us that they are monitoring the situation. Normally, the sports books is packed, but since the scare of the virus, there are fewer players gambling inside. But some players who continue to go are bringing their own sanitizer.
Go like that, a little on, like that. Then you play a little bit and it gets started again.
We also reached out to the Meadows Casino, and they say they have increased fresh air circulation and cleaning for restrooms, door handles, games, elevator buttons, and carpets. And they're sanitizing menus after each guest uses them. Some major disruptions to the tourism industry. Disneyland, Disney World, both closing because of the outbreak. Both parks are expected to be closed through the end of the month. The decision means all 11 of the company's parks will be closed worldwide. Disney is also suspending all cruises through the end of the month. Universal theme parks in Orlando also closing this weekend. Even Mount Everest has been shut down. Nepal has closed all of its Himalayan peaks this climbing season because of fears of the coronavirus outbreak. The suspension of expeditions in Nepal during March through May will affect hundreds of foreign climbers now preparing for the spring season. China has also closed its side of the mountain. Medicine is one of Pittsburgh's top industries. We got an inside look at how one school is forecasting the spread of the coronavirus. Channel 11's Aaron Martin went to Carnegie Mellon University to see how researchers are doing this critical work.
For years, researchers here at CMU have been working on models and forecasts to predict the impact of the flu. Now the CDC wants them to put that work toward coronavirus. Something we learned today is in its early stages.
The colorful curves are previous flu seasons.
Since 2013, researchers at Carnegie Mellon have been forecasting the flu season for the CDC. Now they're being asked to use those skills on the coronavirus.
When it comes to COVID-19, it is much harder because there is not much historical data to go on.
Roni Rosenfeld is the head of CMU's machine learning department and the Delphi Research Group. He says predicting future trends without historical data is nearly impossible. But the forecasting could help prepare hospitals if coronavirus becomes widespread.
This is the resources that we are very worried about running out of. So if we know a few weeks in advance that we're heading towards exceeding our local hospital capacity, that's a good time to implement more severe social distancing measures.
While walking us through how the forecasting works, Rosenfeld emphasized it will be hard to draw any conclusions from a single season of the coronavirus. He says that will be made clear as the forecasting begins in the coming weeks.
We need to be very careful about not only telling them what we think is most likely to happen, but also expressing very clearly how certain or uncertain we are.
He did say that he believes that enough data will be there in order to make an impact even in the coming months. Reporting tonight in Oakland, Aaron Martin, Channel 11 News.
And stay with Channel 11 for more coronavirus coverage. We have all of the resources you need on WPXI.com and on our WPXI app.
Well, we had some wet weather this morning, and now cooler air filtering in behind this cold front. Look at this temperature change just from yesterday at this time, 5 degrees colder in Pittsburgh, 6 in Beaver. It's just talking about cooler air moving on in behind this front, bringing some drier air with it. But what we also have are those strong gusty winds, and I wanted to show you, this is always beautiful, the visible satellite radar. Just showing you that we have those clouds moving out and the clear skies behind this front. Look at this, PennDOT cam out of Wexford on 79. Look at the blue sky out there. So clouds are decreasing. We're going to have plenty of sunshine across us this afternoon as that dry weather now is here with us and holds in place through tomorrow. We do have a chance to see some wet weather back for us this weekend, and I'm going to pinpoint that on Storm Tracker. And who could see some drizzle or some light rain showers, even a wintry mix this weekend coming up in the next 15 minutes. But let's talk about that temperature drop we've had from this morning. 49 right now in Pittsburgh, 52 in Washington. So still hanging on to the 50s this afternoon because the sunshine keeps us in the lower 50s later on this afternoon, still at 3 o'clock, looking at 52. Once the sun goes down and the winds start to die down, those marks will fall to the lower 30s for us overnight. Wind speeds continue to stay up through the afternoon hours and into the evening, but that drier weather, it's here. Back with us, so great conditions to wash the car today and even parts of the weekend. I'm going to pinpoint the timing on the rain or who could see some snowflakes mix in coming up in the next 15 minutes. Peggy, back to you.
Only Channel 11 is there as police arrest 3 people in an arson spree.
Back of our house it sounded like an explosion.
What 2 of the victims are doing now because they were so rattled by this.
News is happening in your neighborhood. Channel 11 News is there.
We're in McCandless, Cranberry, and Butler. We cover news everywhere you live, not just downtown. We're in Aliquippa, Coraopolis, and Moon.
Bringing you stories that impact your town. That's what makes Channel 11 News different.
More local news from more neighborhoods. That's a fact. We're in Bethel Park, South Park, and Mount Lebanon. When you want news from where you live,
watch Channel 11 News.
Of Health, Dr. Rachel Levine is giving an update on coronavirus and efforts to stop the spread in Pennsylvania.
This afternoon, we have 33 Pennsylvanians who have tested positive for COVID-19. In addition to the cases we released in our morning update, we have 2 adults from Delaware County, 2 adults from Philadelphia County, and 1 pediatric patient from Monroe County. To date, there have been more than 300 Pennsylvanians who have been identified for testing. More than 140 of those have tested negative. 33 have presumptive positive tests. 6 of these tests now have been confirmed by the CDC as positive. And nearly 130 tests are on their way to the lab or being processed at the lab now. So pending means not just at the lab, but on the way to the lab. It's an important distinction. There is also the 1 patient who doesn't count towards our numbers, who is from another state. And so I'm going to stop saying a certain number plus 1 and assume we all know what we mean now. It is important for everyone to remember that this is really a very rapidly changing situation. The guidance that we receive from the CDC, especially about testing guidance, changes daily. We are getting calls from concerned Pennsylvanians about whether or not they should be tested. If you do not have any symptoms, you do not need to be tested at this time. If you have very mild symptoms, like a stuffy or runny nose, that could be a cold, that could be allergies, you do not need to be tested at this time. But if you have the following symptoms, a temperature of over 100 degrees Fahrenheit, shortness of breath or cough, please call your healthcare provider. They will help you determine if your symptoms are in line with or consistent with COVID-19 and if you need a test. If you do not have a healthcare provider and have these symptoms, we really recommend that you call the emergency department at a hospital and not just show up, because if they think that your symptoms are consistent with COVID-19, they will take precautions. Please don't go directly to the emergency department, call first. There have been questions from doctors of who doctors can test and what permissions they need to do from testing. If a healthcare provider feels a patient should be tested, they can order the test now without consulting us. There are commercial laboratories that work with providers, that work with hospitals and health systems, and will work with them on specimen collection, transportation, and testing. So there are at least 2 commercial providers that will do that now. There are more coming up next week, and we're aware of hospitals and health systems that are working on developing their own tests so the tests could be done in-house from a hospital or health system. If the provider would like to consult with the department to determine if a test is required, that's fine. And please call us at 1-877-PA-HEALTH, and we welcome those calls. If the provider consults with us, and we don't recommend a test because of CDC criteria, but the provider really wants to do a test, then order it and send it to a commercial laboratory. You do not need our approval to send tests to the commercial laboratories. And we will get those results through our information system, our positive or negative results, so that we'll know the numbers. Now, it's very important that everyone remember that there are very simple steps that people can use to protect themselves from the spread of contagious diseases, including COVID-19. Please wash your hands with soap and water for at least 20 seconds, the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover coughs and sneezes with your elbow and not with your hands. Please try not to touch your face, because if you touch a surface and then touch your face, that could, in theory, transmit COVID-19. Clean surfaces frequently. And if you are sick, please stay home until you are feeling better. Practicing these everyday simple steps can help slow the spread of this virus, COVID-19. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. Now, as this situation evolves and develops, we will continue to update Pennsylvanians through our website, our Facebook, our Twitter account, our press releases, our press conferences, etc. If you have questions about your health, please contact your healthcare provider. And we have been working very hard to update providers on how to assess patients and with information about testing, and we will continue to do that. What is most important for everyone in Pennsylvania to remember is please stay calm. We have the networks in place to ensure that we will continue to strive for our vision, which is a healthy Pennsylvania for all. Thank you. Now I'm available for questions.
Sorry. No worries. She'll be here. I haven't slept for a while. Do you believe the Pennsylvanians that need testing are getting tested, and talk about the impact of the commercial laboratory?
So we are striving to make sure that everybody that needs to be tested gets the tests, and we're continuing to work in all of our communications, like this press conference, as well as our press releases and our website, and working with the healthcare providers. If a healthcare provider feels that a test can be done, it can be done. But it's fine to call us and discuss it at 1-877-PA-HEALTH, but they do not need our permission to send a test to a commercial laboratory. So I think that the addition of the commercial laboratory is very, very important. And then as more hospitals have their ability to test in-house, that'll make tests even more available. But we do have tests available at the Pennsylvania Department of Health. We have tests pending as we speak. We're working with county and municipal health departments as well as providers to process those tests. If the test is done at our laboratory, it's free. If the test is done through a commercial laboratory, they will bill insurance, and all insurance companies in Pennsylvania and Medicaid will cover the COVID-19 test.
As the number of cases increase, is the Department of Health considering giving out more precise, specific information about location of cases?
So, that's been a big issue that I know that we have been discussing. I think that we are giving out issue that is information that is necessary to protect the public health. And so if there was information that would be really necessary, that would change a public health response, we are giving that information. So we give the counties. We're now giving out information about the numbers, etc., because I think that that's important now. But to know the township of someone is, I mean, if someone is tested positive for COVID-19, they are isolated. So they're either isolated at home, and us, as well as the county munis, are monitoring them, or if they're ill, they're in the hospital. So they're not going to be walking around the neighborhood, and they are isolated at home. I guess they might be in their backyard. So that type of specific information I know is of interest, but it doesn't serve the public health. So we will be releasing whatever information is necessary to serve the public health.
Follow-up to that. So the concern that I'm hearing is that municipalities that don't have like a local health board won't necessarily know, like their EMS won't know if they're responding to a household with a sick person, and then that can just spread the virus to everyone. So how are you handling that?
So we'll work with EMS to make sure that they can deal with those situations.
How are you working with municipalities?
Yes, right.
We've been in constant communication with our Regional Emergency Medical Services Council about the best ways to proactively prepare for calls just like what you're speaking about. And we're talking in terms of personal protective equipment and how EMS providers can best handle calls like that. We'll continue guidance just like that to speak to exactly what you're asking about.
But that we have so few numbers and we don't have community spread, so they don't have to wear like the mask and protective gear for every home yet, right?
I would urge all EMS providers to take all necessary precautions when responding to all sorts of emergency medical calls, and EMS providers are trained to utilize all sorts of personal protective equipment when responding to calls.
And are you making sure municipalities that are under your jurisdiction have that information of where they're living and have protective equipment?
I can't speak to this specific location information regarding patients, as Dr. Levine has already spoken to that specifically. In regard to personal protective equipment, I can tell you that the Department of Health is constantly in communication with county and municipal health departments, as well as our federal partners, to make sure that not only do we have stores of said PPE, but also the federal government is aware of where our stores stand and anything they can do to assist.
So one final word, if an EMS officer or agency has a concern about how they should respond, call us. And we will work it. We will discuss that with them, with Deputy Secretary Bereshansky and Dylan Ferguson, our EMS director. So we'll work through that with EMS companies. So call us. We'll help them.
Dr. Lee, did you get the breakdown by counties of the 33 cases?
It's on our website. I don't have all the 33 patients' counties.
Well, before the press conference, the total for Montgomery was 17. Have there been any cases added to Montgomery? And if so, I have a question.
Please ask your question, and we'll check the data with you.
Should the counties that are adjacent to Montgomery, which is Berks, Bucks, Chester, Lehigh, etc., is there a greater concern for those counties than counties farther out from what Governor Wolf called the epicenter?
Well, so we're monitoring the situation throughout the state very, very closely. But you're correct that most of the cases have been in the southeast, although not exclusively in the southeast. And so we are going to monitor that really, really carefully and help any county with what their response. Did you want to respond?
Matt and then Mark.
I believe it was last week, the amount of testing that can be done at the state lab was increased. Is there any efforts being done to increase even further as we get more and more tests?
Yes, I mean, we've talked about 100, so we've gone from 5 to 25 to 100, and there are some pieces of equipment where we might be able to go more. We are very dependent upon the supplies, the reagents, which means the chemicals and the kits from the FDA and the CDC, but we are receiving those, and we'll work to test as many kits as we can.
Mark.
So, just to kind of follow up on that, is your testing limited by the number of kits and regions that you have?
So we're not limited right now. There are no backlogs of testing. So we're not limited right now. Could, in theory, if everyone in Pennsylvania was going to be tested, we couldn't do that, right? So
why not? Why not test more if you have the capacity to do more?
Well, sure.
Why screen people with criteria instead of trying to test more people when you have the ability.
I understand. Right now, Pennsylvania, we are not working with the CDC. I mean, they're not working with us to do population-based testing. So I am aware that population-based testing can exist. That's not their recommendations for Pennsylvania at this time. It might come to that, but if you think of how many people are in Pennsylvania, certainly that would be beyond our laboratory. So it's not that there's no limitation. It's just that we're not limited at this time. So to do a population-based testing would be beyond us at this time, but we might have to do that in the future.
But you're not limited at this time because you already are limiting the number of tests that you're willing to do. Do you see what I'm saying?
Yeah. So you're talking about different ways of evaluating a population. And so right now, the recommendation for us in the CDC is still to do symptom-based testing, to do testing based upon symptoms consistent with COVID-19, as I talked about, a fever, cough, and shortness of breath. It might come to a time to do population-based testing. It's obvious. I'm looking at the population of the Southeast, about how many tests would be necessary. I mean, that would be a limitation for us. We would have to work with the CDC about how, for any state in any area, about how that would be done.
Are you bound by CDC guidelines? Do you have to be bound by them?
No, but we would not have the capacity to do population-based testing, which is testing everyone in the Southeast, right?
But are the private labs essentially doing population-based because they don't have the same, they're not obeying the same limitations?
No, but a person can't get tested by a private lab without going to a healthcare provider. Right. And we're recommending that, if a healthcare provider feels someone should be tested, they can test them. The other thing you have to remember is when you do population-based testing, a negative test doesn't mean they're negative. Right? If you have no symptoms, then you could develop symptoms 5 days from now, but the test would be negative but could turn positive later.
But what you're saying is that the physicians who send someone to a private lab are not bound by the same criteria.
No, they don't have to call us, but they're not doing population-based testing either. They're testing patients with symptoms. That's where we are now.
But there is something in between population testing and the CDC criteria, right? And you can...
And that's pretty much where we are, in between population-based testing and strictly following CDC criteria with relaxation of our guidelines. That's exactly where we are. With relaxation of our guidelines and the private lab testing, then we're not at population-based testing thousands and thousands of people, but we're not just following exactly the CDC criteria. So that's exactly where we are.
Should we be at population-based testing?
Not at this time.
Matt.
I guess to sort of follow up, you were saying we're sort of in between, you kind of relaxed the guidelines. Can you sort of talk about how those guidelines have been relaxed?
So I think that the CDC guidelines, although I'm going to maybe defer to Dr. Watkins in terms of exactly the guidelines were today, but they have focused on exposure. Have you been exposed to travel history or someone who might have COVID-19? But what I just said is if a physician sees someone that has fever, cough, shortness of breath, might consider doing a flu test. We still see a lot of flu. It'd be extremely unlikely to have both at the same time, but if the rapid flu test was negative, then they should consider COVID-19. That's not exactly to the CDC guidelines, but that's completely different than population-based testing, which would really be a landmark change in terms of how testing would be recommended by the CDC for Pennsylvania, and so we're not there yet.
Chelsea, then David. Could you, kind of two-part question, could you talk about social distancing? We've been hearing about the funeral for the Cumberland County firefighter who died. His funeral is tomorrow, and they're expecting 1,000 people to show up. Some EMS providers have raised concerns over that happening, and if you could just talk about maybe why.
We have no documented case in Cumberland County. We would have told you that.
No, I'm saying for the funeral tomorrow. There's supposed to be 1,000 people gathering.
Oh, I see. I see.
And
yes.
Why social distancing is important.
Well, social distancing is important, right? The COVID-19, unlike something like measles, could travel through air for probably up to 6 feet. It's probably a little less, but let's say 6 feet. And so if you are 6 feet away from someone, then you're much less likely to be exposed to the virus in terms of the air droplets. So if they sneezed or they coughed, it's not going to travel more than 6 feet. And so we want people, if possible, to be least 6 feet away if that's possible. We also want people to not touch a surface and then touch their face, because if it lived on the surface, you've now touched your face, it's more easily transmissible. And then wash your hands 10, 20 times a day, as I described. Use hand sanitizer. If someone does cough and sneeze, to do it into your elbow. And be honest with you, even though it's a funeral, if someone is sick, please stay home.
All right, you've been listening to the State Health Secretary in Pennsylvania, Dr. Rachel Levine, saying again all the things we need to know. Hand washing 20 seconds, cough and sneeze into your elbow, do not touch your face, clean surfaces, stay home if you're sick. And are 33, that is the update, 33 Pennsylvania residents who have positive cases. One of those happens to be a pediatric patient. All those cases still on the eastern side of the state. And NBC News reporting that the president is going to be declaring a national emergency this afternoon. He's set to address the nation at 3 this afternoon. That's all for Channel 11 News at noon. Our next newscast comes up tonight at 5. Have a great day.
Breaking News Desk is really an invaluable tool.
You're going to get breaking news as it's happening. You can be assured that everything I tell you is something that's important, that's going to impact your day.
We have an anchor now dedicated to following the latest information as it comes in.
I know the neighborhoods, I know the school districts, and that really helps to inform you so that you know